Hi guys, this is Azar again, physical therapist. Today we're going to talk about one of the most common symptoms of the hand that everybody wants us to cover, carpal tunnel syndrome. A lot of you have heard about this. Numbness tingling in that three fingers, again the median nerve, the nerve that passing through here, down here, all the way, and mostly innervate all the three fingers here. I'm going to show you a picture. This is the median nerve entrapped in between the tendons. You can see these tendons, the flexor tendons right here, the white ones, and the median nerve is really angry right here. This is shown with the red. It's underneath that bridge here. It's a closed area, closed tunnel with all of the tendons, flexor tendons, and the nerve in there. If all the tendons get tight or that gets rubbed a lot to the tendons, that ligaments, we can get something we call carpal tunnel syndrome, or pressure on the median nerve. So if we get pressure on the median nerve, the first thing we should do is massaging the carpal tunnel area, get rid of the inflammation and scar tissue right there, massaging the flexor tendons, make sure they are not tight, because when we overuse, when we type, when we do a lot of things with the hands for so long, or when we sleep in the fetal position with the hand like this in flex position, we can get a lot of pressure on that area. So we release it first. So first thing is release. Go to physical therapy, ultrasound, massage, all of the released tension stuff for the carpal tunnel area, and then we can start doing our stretches. We can run one quick test. This is a Phelan test. Do this. If you have numbness tingling in this three finger, by holding it for 30 seconds, you most likely have carpal tunnel, but that's what physical therapists do in the office to make sure about diagnosis. What we should do, we should reverse that. This is the best stretch for carpal tunnel. The golden stretch. Every day. More than 5 times to 10 times, 30 seconds to 1 minute hold. You might get a little numbness first with this, but later on when nerve gets stretched out and get lengthened, you're gonna feel better. Again, this problem can cause a lot of other issues on the tendons too. That's another one, that's a tendon release. So we're gonna do this, 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 open, and then pull. We're going to do it in the steps. Start with this, then this, open this, stretch. That's a tendon glide. We're going to glide the tendons of the thumb to help that nerve to breathe, the median nerve. So another one's going to be the grip strengthening. As soon as we find out that we are almost symptom free, the numbness tingling is decreasing, the pain, excruciating pain is decreasing, maybe they gave us the night splint for a couple nights or for a couple weeks to make sure at nights the hand doesn't go to that position and doesn't cause more issues or problems, or we staying away from typing or repetitive motions, and the symptom decreasing. What we're gonna do, we're gonna strengthen the motion that are lost. So the first motion that's lost is the grip. This is the putty. Therapeutic putty. I'm going to show you right here. You can use the Play-Doh too. So this is going to be for grip strengthening. You can do this first. Strengthen your grip. The next motion that can lose is this one. You're going to lose that, and then you're going to be doing this instead of doing this. How we can test it? We have you put this. If you can do it, fine. If they can do and then they start doing this, they are not fine. The median nerve is not working. So what we can do in that case, we can do this and try to strengthen this motion. Okay? Another motion is abducting the fingers. That's going to be gone too. What we can do for that, we can use simple rubber band. Open, close, and you open, close, abducting all the fingers, strengthening the abduction. You can use this, very simple, that's for grip, but that might be a little too hard for the early stages. If you feel better later, you're allowed to do more stuff. We basically can cover some weight bearing stretches again, like this. Put your hand there, stretch, very good stretch for carpal tunnel. It's the same as this almost, but in weight bearing. We don't want to do this a lot. This is a no-no because it's going to put a lot of pressure on the median area. That's what happens during the night, and we don't want that. So we want to make sure you have a splint that put your hand in the neutral position. That's the neutral position. That's a bad position for people that type like this. Too much pressure on this area, and then too much extension here. And people that go like this, that's even worse. So neutral position. You can put a splint there if you can't put the hand in the neutral position. A lot of ergonomic thinking. Think about where's your computer, where's your keyboard, how you do things, and don't do repetitive stuff. Get up and stretch in between. Get up and pray. How about that? Praying stretch. So another thing in that problem is gonna be the wrist strengthening. Wrist strengthening is not gonna be our priority for the carpal tunnel people because they are usually so inflamed. By doing a lot of wrist strengthening, we can put more friction force in there and cause more problems and make it worse. So we're gonna save it for later. When all the symptoms are almost gone, we're gonna start doing the wrist strengthening. Right? So this is our last priority. Okay. All 4 directions, last priority in the later stages. So our goal, decreasing the numbness tingling here, increasing the grip and pinch and ability to do that fine movement, riding, all of this stuff, and then hopefully decreasing the inflammation and tightness on the wrist, also wrist flexors, and decreasing the inflammation on that ligament that we already talked about it, the bridge. If we can't do that, surgery is the last option.